You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, Thanksgiving is next week, and we are entering a significant problem phase here in this winter dealing with coronavirus. As of today, 11.1 million cases of COVID-19 in the U.S., and the numbers continue to climb at an alarming rate. 246,000 people have died from the virus. Michigan Governor Gretchen Whitmer is putting new guidelines in place to deal with the spread. But it's not just her. Numerous states are doing the exact same thing. Here is the Michigan governor talking about this.
Now we have reached that point we were warning about. We are in the worst moment of this pandemic to date. The situation has never been more dire. We are at the precipice, and we need to take some action. A leading model shows that if we don't take aggressive action right now, we could soon see 1,000 deaths per week here in Michigan. Today, the Department of Health and Human Services is issuing an epidemic order to help us slow the spread of COVID-19 and save lives. The order takes effect on Wednesday at 12:01 a.m. and will be in effect for 3 weeks. And we will continuously monitor the data throughout to determine next steps.
We cannot forget how this administration has done a horrible job when it comes to addressing this issue today. Joe Biden and Kamala Harris, the president-elect and the vice president-elect, held a briefing where they got an update on COVID-19 as well as talked about its impact on the economy.
Joe Biden won the election decisively, with more votes than have ever been cast in American history. It amounts to 75 million voices and counting, calling on the Supreme Court to see this case for what it is, a blatant attempt to overturn the will of the people. And the president-elect and I cannot let that happen. And we all know that if the Affordable Care Act is struck down, communities of color would be hit particularly hard: Black, Asian, Hispanic, and Native American, because they are at a greater risk of pre-existing conditions from asthma to diabetes to lupus. And they are also 3 times as likely to contract COVID-19 and twice as likely to die as others.
Now, in the middle of a deadly pandemic that has infected more than 10 million Americans, nearly 1 in every 32 Americans, often with devastating consequences to their health. These ideologues are once again trying to strip health coverage away from the American people. The goal of the outgoing administration is clear from the brief they filed in the Supreme Court. It asserts, and I quote, "The entire ACA thus must fall," end of quote. Now, I'm not naive about the fact that health care is an issue that has divided Americans in the past. This doesn't need to be a partisan issue. It's a human issue. It affects every single American family. We can't subvert the growing consensus of the American people based on an argument put forward in the briefs seeking to invalidate the law that even many conservative legal scholars, including in the National Review, consider to be, quote, ridiculous. Let's be absolutely clear about what's at stake. The consequences of the Trump administration's argument are not academic or an abstraction. For many Americans, they're a matter of life and death in a literal sense.
Now, folks, keep in mind, while all of this is going on, White House Coronavirus Task Force member Dr. Scott Atlas has criticized Michigan's new COVID-19 restrictions in a tweet shortly after they were announced Sunday evening, urging people to, quote, rise up against the new public health measures. Donald Trump, playing to his base as always, says there will be no lockdown.
While healthy Americans have gone back to work and to school, we continue to spare no expense to protect the elderly and the vulnerable. According to some estimates, a national lockdown costs $50 billion a day and hundreds of thousands of jobs every single day. Ideally, we won't go to a lockdown. I will not go. This administration will not be going to a lockdown. Hopefully, whatever happens in the future, who knows which administration it will be. I guess time will tell. But I can tell you this administration will not go to a lockdown. There won't be necessity. Lockdowns cost lives, and they cost a lot of problems. The cure cannot be, you got to remember, it cannot be worse than the problem itself, and I've said it many times. So this administration will not go, under any circumstances, will not go to a lockdown, but we'll be very vigilant, very careful. We understand.
All right, folks, joining me right now to discuss the latest surge and the need for a new plan of attack is Dr. Ebony Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia, and Dr. Georgia C. Benjamin, Executive Director of the American Public Health Association. Ebony, Dr. Hilton, I'll start with you first. The exploding numbers, Dr. Fauci and others said this was going to happen, and it is indeed happening. We are seeing the numbers go up and up and up and up. And to see a White House actually say, rise up against the governor of Michigan, she is trying to save lives, and these fools are still operating as if, everything is all good, fight, fight, fight. And this is the same governor who they arrested folks who wanted to kidnap her because of previous restrictions.
Right. It actually should be criminal at this point, because we already know what is anticipated to happen. The CDC, with their modeling way back in March and April, I was tweeting every day of how they said their models show between 240 to 1.7 million Americans will die before the end of December. And what do we see? We are right at that 250,000 people that have died. So we know these numbers to be true. Now, the question is, where do we go from here? And what we're seeing is that we're now estimating between now and Inauguration Day, another 100,000 to 150,000 people will die. That's what we have to deal with. And so we don't have time for games. At this point, over 100,000 people are being diagnosed with COVID-19 every day. By Inauguration Day, we're estimating that will be 400,000 people diagnosed every day, with upwards of 20,000 people dying a week. That's what we're looking at. So this game that Donald Trump is playing with people's lives, we have to realize that he is a man who thinks only of himself. And right now his ego is bruised, and he will do everything to take us down with him. We have to be vigilant, wear your mask, don't touch your face, wash your hands, and stay in your house.
Dr. Benjamin, again, when you see on one hand how this administration is responding, they're responding as if numbers are not increasing. And Donald Trump still continues to assert, well, the numbers are only increasing because we're testing.
Well, he's wrong. You know, they just checked out. And that's the problem. Dr. Hilton's numbers are right on target. And that's the problem, is that unless we continue to emphasize those preventive measures that we have of wearing a mask, washing your hands, keeping your distance, and we're now going to have to look at selective closures. That's the only way we're going to save ourselves, and remind ourselves that those deaths are tragic and terrible, but we have 11 million people with the disease, and that number is also going to grow dramatically.
You know, this is, I mean, it's unbelievable to see, and then we start looking at the charts where the explosions is coming from. Red states, Ebony. That's where it's coming from, and you already have these governors who have already come out and say, Joe Biden, if you try to put in a mask mandate, we're going to fight this. And you're sitting there going, idiots, can you not see what's going on?
And that's what I say, America, we see that ego and arrogance and ignorance will be literally the thing that breaks us, not only in terms of health, but also in terms of economic crisis. If we followed simple rules, we wouldn't have to talk about a shutdown. All these rallies, when you're saying that these outbreaks in these red states, what you're seeing is that Trump has gone to visit each of those states, holding massive rallies of where people are spreading COVID. And then within 5 or 10 days, when they finally start to see symptoms, they've already infected that many more persons. And so the question is, when do we put our ego aside? because this disease is not care. Again, I say that every time I'm on the show. And now we have Ben Carson sitting up there looking infected because you're refusing to follow just simple science. And you know what simple science is. So it's now a choice for you to go and do this. And this virus will make you humble. It's humbling a lot of people right now.
The video we're showing right now, George, is of El Paso, where inmates actually were brought in to help move bodies. They had to bring in trucks. The morgue has been absolutely devastated and overrun in El Paso, Texas. Numbers are blowing up. And again, the local television station obtained this video. I mean, this is where we are. You would have thought after March, after April, after May, people would have figured that out. But no, we're
to see this same picture, tragically, in the other Midwest states, you know, South Dakota, North Dakota, Wyoming, Montana. And it's not just the COVID. COVID is terrible. But the problem is when the hospital gets overwhelmed, then they can't take care of heart attacks or strokes or people with chest pain or abdominal pain, people that have to have their appendix taken out, kids with fevers and earaches. They can't take care of those simple diseases and those life-threatening diseases. And so the morgue will get filled with not just COVID cases, but cases from other preventable medical conditions that they just don't have the ability to take care of.
Ebony, obviously a new administration will be coming in about 65 days. But surely as a doctor, you're concerned that they're not even getting the proper transition. I mean, you don't want there to be pretty much a situation where they walk in, it's kind of like, oh, y'all figure it out for yourselves. You need to know exactly where we are, where do we stand, things along those lines. And the Trump administration is giving no assistance whatsoever to the Biden folks. It's America, be damned. We don't care. We lost, so y'all the reason why, so the hell with the new people.
Right, and fortunately for us, science is pretty easy to follow. So Trump, if you want to play your tantrum, go ahead and do it, because we already know what we have to do. We need to strategize. We now have 2 vaccines that are in the running. Thank God. We have Pfizer and we have Moderna that just released their some of their early results. Now we have some more studies that have to be peer reviewed, and we have some work that we have to do, but they are being promising in the fact that they are showing some effectiveness. So we know what we have to do. When we are getting this committee together, I'm sure they're right now thinking, how do we distribute this? Who do we say? Because it's not like they're going to have these billions of vaccines doses ready to go on market. We know that there's only going to be about 20 million people that can possibly be vaccinated in December. So how do we make sure the most vulnerable of those persons get vaccinated first? So that's going to be our elderly people, those who have pre-existing conditions, those healthcare workers, and those essential workers too, I feel like need to be in the very front of the line. Those grocery store workers, those persons who literally kept our nation afloat and that have been dying at massive rates in comparison to everyone else. Let's help to protect their lives first as we're getting these doses in, with hopefully everyone in the nation being able to have a vaccine by midsummer.
And again, if you want to know whether or not Trump gives a damn, the Washington Post reported he hasn't attended a coronavirus task force meeting in months. Here is one of the admirals on ABC This Week actually confirming that.
Admiral, we know who is not shouting that message to the American public, and that is Donald Trump. The Washington Post is reporting this morning that the president has not attended a coronavirus task force meeting in at least 5 months. Is that accurate?
That's true, but the vice president does chair the coronavirus task force. The vice president, we often have several cabinet members there, and the vice president briefs the president every day or nearly every day on coronavirus. So I'm not concerned that the president doesn't attend. The vice president is there, Secretary Azar, the leadership that's there, the scientific community, Dr. Birx, Dr. Fauci, myself, Dr. Hahn, Dr. Redfield. You know, we're all working, and the docs work literally every single day together. We put out over 50 million of the card-based test, another 8.5 million this week.
Admiral, I want to...
monoclonal antibody.
Admiral, we know who is not shouting that message to the American public.
Again, George, is the fact that the President of the United States, I mean, this is the greatest threat affecting the country right now. right now, and he hasn't attended a task force in months. He's getting briefings. That is an abomination.
It's an absolute failure of leadership. Leadership matters. And while I'm pleased that my colleagues, those physicians, are working very hard and doing the work that they need to do, leadership matters. And the fact is that many people listen to President Trump. And if he told people to wear a mask and stay at home and wash their hands and do those good prevention things, instead of bragging about a therapeutic that I'm glad vaccines are coming, but this is about prevention. We cannot treat our way out of this mess. We need leadership. We need leadership now. And I got to tell you, I am so glad that help is on the way with the president-elect and the vice president-elect. But they're going to need help. People are going to need to give them the information. And I hope that, by tomorrow morning, this administration will finally decide to share the very, very important transition information with the incoming administration, because they're absolutely right. They need that information today.
Well, I absolutely hold not holding my breath in terms of what they're going to do, what they should be doing, because we're talking about people who really don't care, who don't exactly care what's going on. But again, we'll see. But thank goodness we got new leaders who are coming in. George Benjamin, I appreciate it. Dr. Ebony Hilton, we appreciate it. Thanks a lot.
Thank you.
Back to our Roland Martin Unfiltered video in just one. All right, folks, at Seek.com, I want to thank them for being a partner with Roland Martin Unfiltered. Mary Spiel, the founder of this Black-owned virtual reality company. You can watch their content at Seek.com, CEEK.com. This is one of the headsets that you can use. This virtual reality headset. Drop your phone right into here. Look at that content, that VR content on their site. Other 360-degree video puts you right there up close. And so you just pop it on like this, and then you're able literally to just sit here and put yourself in the room and see everything that's around you 360 degrees. Now, if you listen to music, folks, you can check out the music on their Seek.com headphones. These right here, folks, are 360-degree 4D headphones. The bass on these things are absolutely amazing. Surround sound. So literally when you're listening to it, the sound actually is around your whole head. Again, created by a system. If you want to get the headset for the music or the VR headset, simply use this promo code RMVIP2020. RMVIP2020. Christmas is coming up. Some great gifts. In fact, my birthday in 9 days. So I'm just giving y'all a hint. So use a promo code RMVIP2020 and go to Seek.com. And again, we appreciate them being partners with us here at Roland Martin Unfiltered.